Obesity, that all of that visceral fat that you've got in your belly generates a tremendous amount of estrogens. Those estrogens are pro-inflammatory and literally can lead to cancer. They're carcinogenic. The estrogen is carcinogenic. And we talk about the fact that you add the obesity and all the estrogens being created in your fat belly to all the environmental estrogens that you find in canned foods and plastics and styrofoam and industrial waste and pesticides and herbicides and cosmetics and car exhaust. And you wind up in a completely estrogen dominant state where other hormones like progesterone and testosterone are being totally suppressed by all the estrogen. And that is going to ultimately lead to breast cancer, which for the most part feeds on estrogen. Now, here's the important story that I've been building up to. It's going to be a little bit of a curveball. Comes out of Fred Hutchinson Cancer Research Center in Seattle. Listen to this. Obesity, you've got to pay careful attention. Obesity is known to boost the risk of estrogen-fueled breast cancer in women past menopause. We've already established that. New research suggests a link between postmenopausal obesity and an especially aggressive type of breast cancer that doesn't depend on estrogen to grow. So what they're saying here is there are other factors in obesity other than estrogen that can lead to breast cancer. And there's one particular type of very, very aggressive breast cancer, which is encouraged to grow because of obesity, but not because of the estrogen, but because of other factors within the obesity profile. It goes this way. In a new study, women with the highest BMIs, body mass index, had a 35% increased risk of developing aggressive cancer known as triple negative compared to those with the lowest BMIs. That's pretty clear, right? The fatter you are, to put it in plain English, the more obese you are, the greater the risk, up to 35%, of developing this very aggressive kind of cancer known as triple negative cancer, which is not related to estrogen. In fact, it's related to just the opposite. It says triple negative breast cancer is marked by a lack of estrogen and progesterone. The outlook is poor because it is incredibly aggressive. It's an incredibly aggressive form of cancer. It says the long known link between obesity and estrogen positive breast cancers has been attributed to the higher exposure to estrogen in fat tissue, just what we said. So the types of breast cancer that will grow as a result of being exposed to estrogen will definitely grow if you're obese. After menopause, it says most of a woman's estrogen comes from fat tissue. Did you know that? After menopause, the fat in your body is what's supplying your body with estrogen. Basically, it says here in this report, the more fat, the more estrogen exposure. It continues. Obesity increases markers of inflammation and levels of insulin and insulin-like growth factor. All of those things could contribute to the growth of a breast tumor. The study confirms that obesity and cancer risk is not just an estrogen problem. So there are other things in the fat tissue, other pro-inflammatory substances like adipokines and C-reactive protein and angiotensin and insulin that could create the cancer without the estrogen being a factor. So they conclude this way. It's not just the problem of the estrogen feeding the cancer cells. The fat cells, here it goes, may set up an environment conducive to the growth of breast cancer cells beyond the effect of estrogen.